Good afternoon. Hank's in training to learn how to tape stuff, so that's why there's a little bit of a confusion here. Yeah. I'm Debbie Pearson with the Wellness Committee, and although Robin needs no introduction, I'm going to introduce her anyway. You all know Robin Gonzales because she's probably the one that allowed everyone here to enter into independent living, and she's the one that does the best of anyone to keep us in independent living. Robin's been here 13 years, which gives her a tremendous amount, not just of clinical knowledge as a nurse, but that institutional knowledge of how things happen around Westminster, everything. So she's kind of the answer to everything. She's amazing, she is remarkable. I wake up every morning grateful that Robin is here. But she's also, in addition to everything else that you think she does, she is over all of the wellness in the independent living, which means the resident health services. It means she is also over the wellness clinic, and she's over fitness. So she doesn't just have one job, she has multiple jobs, and she does them beautifully. I don't know quite how she does it all. But I'm here to kind of introduce Robin as a human being. So I said, Robin, tell me some things people don't know. What they don't know about her is that she is a huge hockey fan, and I had to write down the teams because I don't know anything about hockey. Texas Stars and Dallas Stars. So for a Texas girl to be, well, you're not really a Texas girl, huh?
Yeah.
Okay. I don't know. Where'd you get hockey in Texas? But anyway, that's her thing. She has 3 cats, Sophie, Chloe, and Maya, a 21-year-old son, Aiden, and you're married over a year now. Last name is Gonzales with 2 Z's, if you ever need to write it down. And so let's hear what Robin, the things Robin will share, what she does, but then there are all these other things that when anyone has a problem, they run to Robin to solve it. So always remember, please, that she has 3 full-time jobs. She manages the health aides. She follows you when you're in the hospital. She has a tremendous amount of work on her desk. So let's be grateful every day for Robin, and I'm excited to hear what she's going to share with us.
Thank you, Debbie. Can everybody hear me okay? Those in the back? Okay, great. So I'm going to be walking back and forth. We're going to post this on the portal afterwards, probably Monday. We'll post the presentation on the portal, and I'll post the PowerPoint. If you want a copy of it, I can certainly send it to you. So yes, this is my little family. I do have 3 cats. One of them I adopted, Sophia up there in the corner. She's my cuddle bug. I did adopt her from an independent living resident who had to move to the healthcare center. She'll probably be the only one I adopt because my house is kind of full now. But the other 2, Maya and Chloe, are twins. We adopted them when they were little babies, and so that's my little family. My son, Aiden, up there in the red cat sweater, he does turn 21 in July, so that's a little scary. And he's about to get a motorcycle, so that's even more scary as a nurse. And yes, this is my husband. We have been married just a little over a year, but we've been together. This year will be 11 years. We got engaged right before COVID. COVID became my life here, and then finally we decided to go ahead and get married because he was like, what are we waiting for? So yes, I have a busy life here, but I do have a busy life at home also. As Debbie said, I have been here at Westminster over 13 years. I have a bachelor's in social work from Texas Lutheran University, a master's in nursing from the University of Texas at Austin. So I use both of them all day long here. I didn't think I would use as much social work as I do, but it really comes in handy. I am a certified dementia practitioner. I've had that certification for about 6 or 7 years now. I worked in the healthcare center for 6 years before I moved over to the independent living side. And I have also assisted out in assisted living, so I have worked every level of care. So if you do have questions, I can speak to each level of care, but I do leave those, make sure that's not my phone. I do leave the intricate questions to the directors of those levels of care, but I can speak to generalized things. Our managing company is Life Care Services. So one of their LCS, Life Care Services, signature experiences is called the Health and Wellness Navigation Program. So that's something we're going to be promoting quite a bit soon. So my role in LCS communities is called the Nurse Navigator. So my title here at Westminster is Resident Health Services Director, but in other LCS communities it might be titled the Navigator. We've had a couple of posts on Facebook, so if you hear Nurse Navigator in the hospital, that would be comparable to a case manager or a nurse navigator. So the goal of that is to guide residents, family members, or caregivers through successful health and wellness transitions to achieve optimal level of well-being and appropriate level of care. So that's our overall goal. This was posted on Facebook. One of the LCS goals this year is, talking about what a nurse navigator does. So there's this scorecard that we have to do, and so it's having a manual, talking to the residents, making sure you know what I do, how I can help you stay in independent living and transition through levels of care. So we're going to be hitting that pretty hard. This is one of the things on the scorecard, was to have a post on Facebook about my job and what I do. So the navigator role is about building relationships with residents, evaluating your needs, solving issues, coordinating programs, guiding residents, families, and caregivers, facilitating communication. Within Westminster, the role of the navigator, or my role, is working with partners inside the community. So I work with every department. There's not one department here at Westminster that I do not actively work with. Assisted living memory support, life enrichment director, which is Rachel's role, if you know Rachel Gill, the fitness coordinator, food and beverage, EVS, activities, accounting, plant ops, the healthcare center, family members. Every single department I touch in some way. That means that department can also come to me if they notice changes in residents. So if you say you go eat in the bistro every single day for lunch, every single day, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday, for years, and then you stop going for lunch. Well, one of the servers may come to me and say, Robin, Miss Smith comes to the bistro for lunch every single day, and I haven't seen her for 3 days. What's going on? And I may say, oh, I don't know, let me go find out. So concerns come from staff members. They have a concern about you being able to transfer in and out of your chair, or they notice Miss Smith, she orders halibut every single day. That's what she likes to eat. I don't like the halibut, I think it stinks, but it's okay. But then when I bring her the halibut, she can't remember that she ordered the halibut. She thinks she ordered the chicken. So they notice changes in your habits, changes in your behaviors, changes in the way you do things. They can come to me and let me know, and then there's a whole cascade of things that happen. When housekeeping comes to your apartment, if they notice changes in your apartment, so that could be changes in hygiene, that could be changes in the way your apartment is kept, maybe changes in cognition, they let me know. Associates can report on concerns and behaviors, confusion, even falls, and then follow-ups are made by me, the clinic, or the life enrichment director. So we have these 8 dimensions of wellness. I'll go over a little bit more of this in my next presentation, but they are physical, emotional, environmental, spiritual, vocational, social, intellectual, and health services. So in all of those 8 dimensions of wellness, it's just how my role, we plan presentations, We plan activities based on those different dimensions of wellness. Oh, what makes me go through all of them? Okay. I also develop or work with outside partners. So we have a therapy group that works here, Select Rehab, so I work with them to provide presentations here or to get residents therapy. They also work on fall prevention, do presentations. If a resident needs occupational speech or physical therapy. I work with home health companies, I work with physicians, with the clinic, nutritional management, so dietitians. I work with outside pharmacies to provide vaccinations, medication education, or to do presentations, hospices, and then I also work with hospital case managers. So if you're in the hospital, I'm calling the hospital to talk to the case manager to see how you're doing, plans on discharge, to see if you're well enough to come back to your apartment or if you need to go to rehab for a little bit. Then we coordinate that care on the best place for you to go that's safe. So as Debbie said, I serve as the clinic director. I don't oversee the day-to-day things that happen, but the overarching stuff, so budget, policies, planning, procedures, things like that. I answer emergency calls, so Monday through Friday, 7:30 in the morning to noon. If you push your pendant or pull your pull cord, I'm the one who comes. We have a wellness check program that I'll go over a little bit in a few minutes, so I'm the coordinator for that. We do an annual medical history update, so I help coordinate that. We do memory health assessments, so these are for potential new residents. So all of you at one point had to do a memory health assessment to move into Westminster, so I do those. And then I'm a wellness committee staff member. So I do wear many hats here. If you look in my office, please don't, but if you look in my office, it's very messy right now because I have a lot of projects going on. But I'm always open to helping you. If you stop by and you need to talk, please let me know. Call me, email me, slide a piece of paper under my door if I'm not there and just say help. Leave your name and your apartment number, your phone number, and I'll call you back. So I usually start off my presentation by asking, by a raise of hands, who has on their emergency pendant? 1, 2, 3, 4, 5, 6, 7, 10, 11, 12, 13, 14. Some people are covering up. So, do we know what the pendants are for? We do. Great, so the pendants are for an emergency. So, if you fall, if you're having a medical emergency, you can push that pendant and help can come to you. So I ask that you please wear your pendant. There's also pull cords. So we have a couple of pull cords in here. We have one by this door. We have one by the back door. You have pull cords in your apartment. We have pull cords throughout Westminster. So that's how you get emergency assistance here at Westminster. So if you're in your apartment or you're visiting another resident or you're in the hallway or you're in a dining room and you need assistance, push your pendant. If you're wearing it, I advise you wear it. If you know you need EMS, you certainly can call 911 on your own, but we still do ask that you push your pendant or pull your pull cord because we could do some things before EMS gets here. There will be a pendant audit coming soon. We do have a new director of security, Bridget, who just started a couple of weeks ago, and so she is going to do a pendant audit. So she asked me to let you know to make sure you locate your pendants. So if you're not wearing it, when you go to your apartment, please find your pendant just so you know where it is for when that audit starts. And to know that each pendant is special to your apartment. So don't trade pendants with people. Don't let people borrow your pendant if they've lost theirs because it's special to you. If Mrs. Smith gives her pendant to Mr. Jones and Mr. Jones pushes it, we're looking for Mrs. Smith. We're going to Mrs. Smith's apartment. So We're not looking for Mr. Jones, okay? So it's special to you, it's special to your apartment. If you do not have one or you cannot find your pendant for this pendant audit, please let security know so that they can make you one. If you are concerned about your pendant not working or a pull cord in your apartment not working, you can call reception or security to ask for them to do a check on your pendant. If you have a fall or an injury, please activate your emergency system. So that's your pendant or your pull cord. Please don't hide that you've fallen. I know in the past there used to be a rumor that if you fell 5 times, Robin moved you. I wish I had that power, but I don't. Sometimes people fall, and the first time they fall, they have to move because there's a major injury or, you know, a major issue going on. Sometimes people fall 40 times, and then we move. So everybody's situation is so different. There are not 2 people that are the same. There are not 2 situations that are the same. So please don't hide the fact that you're falling. There are things that we could probably do in your apartment or with you that can help you be safe in your apartment. If you see someone fall, activate their pendant. Don't activate yours and then walk away, because then we're looking for you. So if Mr. Jones falls and Miss Smith is there and Miss Smith pushes her pendant and then she leaves, we're looking for Miss Smith. We're not looking for Mr. Jones who had the fall. So push their pendant or pull a pull cord that's close to Mr. Jones, okay? If you try to help Mr. Jones up and then you fall on Mr. Jones, now I have potentially 2 injured residents, okay? So leave Mr. Jones on the ground and call for assistance. If you do fall and security responds, security has been educated not to assist you up because our policy is that a nurse needs to come to assess you. Some residents do not want to wait. That's certainly fine. We just document that you wanted to get up on your own and you didn't want to wait for a nurse. If you can get up and you can move on your own, that's certainly fine. We would like you to wait, but you certainly don't have to. For emergency calls, the nurse is responding to emergency calls. We don't automatically call 911. A lot of residents think that. We use our nursing judgment. If we think 911 needs to be called, we may call 911. If 911 EMS shows up and you refuse to go out, that's your right. You can refuse to go out. In our documentation, we will document that in our nursing judgment, we thought you should go out, but then you declined to go. You don't have to go. We can try to see if a friend or a family member may take you. Is it okay to follow up the next day with the clinic? But do you have an injury? Is it maybe a head injury? Are you on a blood thinner? There are some things that we look at to see if we need to really make sure you're making the right decision. The nurses can do CPR, they can provide first aid, they can do a nursing assessment, education, call EMS. They cannot give medications. They can advise you on a medication to take. Say you have a headache, they can advise you to take some Tylenol or something else for a headache. They cannot start oxygen, so if you're having difficulty breathing, they cannot go get an oxygen concentrator that you've never had before and start oxygen. They cannot write prescriptions, and they cannot do procedures. So they can't do enemas, they can't do stitches. We would have to send you out for something like that. My office would follow up with you or follow up with the nurse practitioner. They would call you the next business day. Maybe you need a follow-up appointment with the clinic, with a nurse practitioner. If you are sent out to the hospital via EMS or your family is takes you to the hospital, security writes a report. If a nurse saw you, then the nurse writes a report. Those reports come to me. I review them. I call the hospital you were sent to see what room you're in. I'm calling the case manager to find out what's going on with you. Plans on discharge, do you have a diagnosis? Do they think you're coming back to your independent living apartment? Do they think the doctor's gonna write orders for skilled nursing? So we start talking about what your discharge plan looks like. If they're thinking that you need skilled nursing or rehab, then that's when I tell the healthcare center that, hey, keep a bed on hold. We have our resident in the hospital. We need to start working on an admission. So we have a morning meeting every Monday through Friday where we talk about who went to the hospital, who may need a bed, who's discharging. So we kind of look at what our bed situation is, who's discharging, who needs to admit. So we work really hard at making sure there's availability for everybody. If you come back to your independent living apartment from the hospital, you know, the case manager will let me know what the discharge date might be. We make sure we have the orders if it's home health, therapy. We let them know that we do have a therapy company here. We do have a preferred provider for home health. You can go with another one if you want to. We discuss transportation back to independent living, whether we can assist with that or not. I work on setting up wellness checks. We'll talk about that a little bit later. And then if I need to help coordinate home health and therapy, then I help with that. If you go from the hospital to the healthcare center, I notify the admissions coordinator. I attend care plans. Once you admit over there, I go to care plans as needed. I follow up at our daily stand-up meetings, and then we determine your long-term care needs. So that could be you return to your independent living apartment, what that looks like, or if you're not able to return to your apartment, do you need to go to a higher level of care, or do you need to stay in the healthcare center? So this is resident health services, me, Angie, and Diane. So in our department, we only have 3 people that do a lot. Diane, so she's my administrative assistant. She's also a notary. She does DNR preparation, so if you need a do not resuscitate form completed, she's the one who helps with that. Every year we send out a packet to everybody. We usually do it by building. So I think at the beginning of the year we do Windsor, then we do the Preston, and then the Carlisle. I think we start this year. A whole packet with a list of diagnosis, a potential copy of your do not resuscitate, a blank form with your medication list, all for your vial of life. She creates that, sends it to you. When it returns, she updates information, I update information, and then we create a new vial of life for you. So she prepares all that. She maintains your electronic medical records. She's stationed in the clinic, but she is my assistant. So this medical history update is very important to do. So if you have any changes in your doctor, in your insurance, in your emergency contacts, if you go out somewhere and you get a new DNR, we need to have that on file. Otherwise, if you're a full code, we're going to start CPR. If your power of attorneys change, your medical power of attorney, your financial or your durable power of attorney changes, we need to know that. You need to look at the face sheet, so that's all your information. We send you a copy of that. You need to look at all that information to make sure it's correct. The information that we have is only as good as what you tell us. So if the information is wrong, you need to correct it and then get that to us. So that's what the vial of life looks like. Everybody has that in their refrigerator. Where does it stay? Louder. In the refrigerator. Do you ever take it out of your refrigerator? No, but you can take it out when you update your medications. But then you immediately put it back. So you don't take it out and say, oh, I'll update my medications next week. No, you take it out, update your medicine, put it right back. If you move it somewhere else, a drawer, your bathroom, your balcony, we're not going to find it when there's an emergency. And then we don't know what hospital you want to go to. We don't know who to contact if there's an emergency. We don't know what your allergies are. It just slows down the process. So please, leave that in your refrigerator. If you go to the hospital, we'll update it the next business day. If you go to the hospital and you take that with you and you don't tell us you went to the hospital, say you just went on a whim, and you take that with you and you don't tell us, then we don't know to replace it. So let us know if you happen to go to the hospital and took that with you, because sometimes they're empty. And then we have to fill it again. This is a sticky subject. So a lot of residents have directives to physicians. There's a form called directives to physicians. So that form covers you in the hospital. So that's if you want continued life-saving treatment once you're in the hospital. A do not resuscitate means if your heart stops and you stop breathing, do you want us, yes, to do chest compressions and attempt to bring you back to life, or do you not? Are you okay with that natural death? You've got to let us know. One resident told me, oh, Robin, you just do what you need to do. I'm not going to decide that, and it's probably going to happen when Robin's not at work. So we need you to tell us what you want, okay? I can't decide that. Your family shouldn't decide that. You should decide that for yourself. If you've lived a great, healthy life, you need to decide if you want to still be a full code where we do CPR, we call 911, we get you to the hospital as fast as possible, we're trying to bring you back, or do not resuscitate where we allow that natural death. If you have a scooter, you have to register it in our office. There's occupational training for transfers, navigating the hallways, your apartment, elevators. They're not supposed to be used in the Preston elevators. There are speed limits. You will get a stern talking to. If you are dangerous and you start running into things and hitting people, you do have to repeat therapy, and you could potentially have the electric scooter taken away from you, which limits your mobility, which limits your independence. So you have to be safe in these. These can be dangerous. I've been run over. I have had my feet run over. I've been stuck up against a wall and we've had to lift it off of me. It's not fun. Just a side note, there are people that use walkers that have seats in them. Please don't push anybody in them. So if you have a walker and someone's sitting in it and you're pushing them, it is very easy for them to tip over and then they hit their head on the floor. It's caused head injuries in a couple of our residents. Not only in the person that falls over, but also in the person that falls on top of them. So please don't push somebody in a walker. If they need to be pushed, then they need an actual wheelchair. If you have a pet, we need to know about it. Pets get a vial of life also. So if something happens to you, we need to know about your pet. What kind of food they eat, what they like, what they don't like, where their vet is, who your pet contact is. So say you have a dog, Fluffy, and something happens to you and I have to send you to the hospital. Who's going to walk Fluffy? Who's going to feed Fluffy? Who's going to come and get Fluffy? We need to know who that person is, so they get their own vial of life. So you really do need to register your pet with us. There's also a pet deposit and marketing that has to be paid. This is Angie. She's our fitness coordinator. So she does senior fitness tests, assists with gym equipment and demonstrations, leads exercise classes, and one-on-one instruction as needed. She does educational workshops. There are walking groups, some aqua classes. We're having a little difficulty right now with that. There's classes for stretching, cardio, balance, strengthening, yoga. There's resident-led chair exercises, exercises on 1890, just for men. Is it still just for men?
Yes.
Okay, I didn't know if that was changed. The Parkinson's has now become movement disorders. something like that. There's something for everyone. We do have the gym in the Windsor first floor over by the bistro, and then we have an annex gym in the Preston. This is Rachel Gill. I'd like to throw her in here. She is the life enrichment director. I am not her boss, but we work very closely together. She is responsible for meeting residents' social, mental health, and cognitive health needs. We tag team on a lot of things. So she does a lot of the mental health and social, and I do more of the medical. So she and I bounce a lot of things off each other. So if she is having, or she has a resident who's having some medical needs, she may come to me to answer some questions or speak with the resident or the family. If I have a resident who's having more social, cognitive, mental needs, then I may take it to her. So we work really closely together on that. She provides support through groups, individual counseling, and then has groups on various topics, brain, memory health, and then support groups and discussion groups. She also connects individuals to outside programs and resources, and then does charitable projects, new resident orientation, and then assistance to families and residents during the move-out process. This is the Westminster Clinic staff. On the left is Mindy. She is one of the nurse practitioners. She mainly works in the healthcare center, assisted living, and memory support. The next one over is Ann Lipscomb. She mainly does independent living. The next one is Jennifer. She is the medical assistant. And then Kathy Cody is a nurse practitioner, mainly does independent living. I am the clinic director, but we do have the 3 nurse practitioners. We are overseen by a medical director who is Dr. Pellegrini. We are open Monday through Friday, 8:30 to 5, closed for lunch. If the clinic is closed, so before 8:30, or between 12:30 and 1:30, or after 5, and the screen is closed, the window is closed, the door is closed, please don't bang on the glass. It's not nice, and it scares the people inside when you start banging on it. When we're open, we will have the screen up, the lights will be on, and we will attend to your needs. When you arrive, please sign in, have a seat, and the medical assistant will be with you. This is our new receptionist, Alyssa. She just started 90 days ago. I do her 90-day eval on Monday. So if you haven't met her, Alyssa, she is really sweet. She's the new receptionist at the clinic. The clinic, they can evaluate and treat acute health problems. So those are new problems that have arisen. They can diagnose, treat, and monitor chronic diseases. So those are diseases that you've had for a long time. They can do lab services, so blood draws, removal of earwax. We can assist with getting an x-ray. We work with a mobile x-ray company to do x-rays in your apartment, or EKGs. We have a small EKG machine where we can do an EKG in the clinic, and they do wound care. We submit to your insurance, and we also do have a private pay option. They can assist with vaccines. We do a flu clinic every year. They can do shingle vaccinations. We usually get it from Tarrytown, and then the pneumonia vaccine. They can also do injections that are prescribed by your doctor. Blood pressure and weight checks. You don't need an appointment, but it's been pretty busy lately, so it would be nice if you could call first before you come down. There may be a little bit of a wait. They can do annual wellness visits, and they do follow up after an incident. So say you had a fall or a skin tear and you did call for a nurse to come see you in your apartment, the clinic will follow up with you the next business day. Assistance in your apartment, we have a wellness checks. You can hire a personal service provider through an agency or private duty, home health, hospice, and therapy. The wellness checks program. So these are certified nursing assistants who are employees. This is where it gets sticky. They're employees of Halcyon, but Westminster pays Halcyon for them to provide services to Westminster residents. So I manage them. So they are here 24/7. It is a program that's complimentary. It's up to 2 weeks. So say you came back from the hospital, or say you have an acute condition, an acute illness, or you come back from the healthcare center. The ladies can come and check on you up to 3 times a day, up to 30 minutes for up to 2 weeks. And that's just a service that we provide just to keep you independent in your apartment, just to check on you, put eyes on you, make sure you're doing okay. They can help get meals for you. Say you have an infection and you need to take an antibiotic for 7 days, and you've never taken an antibiotic before and you can't remember to take it, they can come by during the day to remind you to take that medication. They can assist in getting meals for you if you're not feeling well, pet care, showers in an emergency, or as an introduction to private duty. Sometimes hiring someone can be scary, or you feel like it's an invasion of privacy, where this is kind of like a let's see how it goes. So we could do the wellness checks, have someone come in a couple of times a day, see how it is, and then you hire someone permanently to come in. Personal service provider, so this is where you actually hire someone privately to come help you. It could be a private housekeeper, caregiver, or companion. There is a packet. If you don't go through an agency and you just hire someone off the street, I don't recommend that. But if you just hire someone that's not through an agency and you're just paying them out of pocket, there is a packet that they have to come to my office and get. And it's got instructions. They have to read our code of conduct. They have to read our policies and guidelines. If they work more than 20 hours a week, then they get a fob to have access to park in our Carlisle garage. They have to do a TB test and a background check. Our preferred provider for private caregivers is Halcyon. They do private duty, home health, and hospice, but I do have additional agency recommendations also. For private duty, they can assist with bathing, grooming, meals, housekeeping, companionship, errands, transportation, medication management. It's where a nurse manages all the ordering, the reordering, and the setting up a pill planner for you. Or they can do medication reminders. That's where someone comes once, twice, 3 times a day to remind you to take your medication if you're not able to remember to do that. With Halcyon, because they do have a big presence here, the visits for their private caregivers can be anywhere from 10 minutes a day up to 24/7. So they do have a variety of time frames for them. But it is paid for by the resident. Home health can be provided in your home. This is more nurse follow-up. So this is usually if you have a change in condition, so after a recent hospitalization, after a surgery, a change in medical condition, wound care, recent falls, muscle weakness. So a nurse from an outside company, an outside agency comes to your apartment, is going through your medications. We may get therapy involved. They're really taking a look at you, checking your vital signs, following your progress, hopefully getting you better and stronger. Hospice care, there is actually a presentation next week, June 4th. Hospice Austin is coming, and they're going to do a presentation on hospice. Everything you didn't want to know, but glad you asked. I think that's the title of it. For hospice, you can stay in your independent living apartment. We have had several residents in independent living beyond hospice. We do support that as much as possible, unless your pain is uncontrolled or we just can't support it, then maybe we have to move to the healthcare center. It includes a physician, nurse, social worker, chaplain, volunteers, home health aides. They do all the supplies, briefs, oxygen, wound care, bedside commode, that's what that is, hospital bed, and pertinent medications, but they don't provide one-on-one care, so hospice wouldn't provide someone to be with you 24/7. That would have to be provided by either family or hiring someone. Move to the healthcare center if needing extensive nursing care. There are many companies in Austin, but there are only a couple that we work really closely with. Select Rehab, this is the company that provides therapy here. Physical, occupational, and speech. Physical, I think about the big muscle groups. So strengthening, walking, endurance. I was gonna say running, but occupational is more those fine motor skills, the dressing, the little buttons, speech, neck up. So it's not just speech, it's also cognition. If you do get an order for therapy from your outside doctor, bring it to me. Then my assistant verifies your insurance, and then we send that to Select Rehab, and then they contact you to set up the evaluation and treatment plan. So Westminster's goal is for residents to stay in their independent living apartment as long as possible. We like you to age in place as much as possible. To move to a higher level of care is an interdisciplinary team, family, and resident decision, unless the resident is a harm to themselves or to someone else. Then we can insist on a move. Otherwise, it is a joint decision. For an admission to a higher level of care, we're going to start the conversation. We're going to do some fact finding. I'm going to do some fact finding. I do keep the interest list, so if you tell me, Robin, things are getting harder, it's harder to get dressed, it's harder to get to the dining room, you know, I'm tired, I'm going to find out, I'm going to ask questions. Why? Why is it getting harder? Why do you think it's getting harder? You know, what can we do to help you? Can we get therapy involved? Can we get the wellness aides in there to help you? Or, you know, do we need to do some labs with the clinic? Maybe there's something acute going on. We do assessments. The Arbor does not have walk-in services, so you can't just go check yourself into the healthcare center. You can't just go check yourself into assisted living. There is a process for that, and you have to qualify. It's a planned admission. These are usually the reasons to move to a higher level of care: poor hygiene or incontinence that's not able to be managed, falls with major injuries, uncontrolled pain, losing weight or unable to get food or eat, unable to transfer in and out of bed or on and off the commode, belligerent or abusive to residents and staff, unable to use the emergency system, wandering or lost inside the building or outside. Residents can stay in their aisle apartment as long as they are safe to do so. So maybe some of those things are true, but you hire someone to help take care of you. Or maybe some of these things are true, but we get therapy involved and things get better. So this may be happening, but maybe we can fix them. So I always go over some things that residents have brought up, because maybe these are burning questions that other residents have that you think about when you're lying awake at night. After hours emergencies. So if there's an emergency after hours, you can push your pendant or pull your pull cord, and security usually comes first. If you need a nurse, then they radio for a nurse, and a nurse can come and assess the situation. Maybe it's first aid, maybe it's a medication that they can advise you to take, maybe it is going to the hospital that needs to happen. But everybody, okay, I'm not gonna say everybody, 99% of the residents here have a primary care physician. Those primary care physicians have an on-call and after-hours phone number. So you can also try calling your doctor after hours and on weekends. So you can save in your phone after hours MD and have their after hours number programmed into your phone. So you can try your doctor also. Again, we can't do procedures, we can't write prescriptions, we can call 911. There's also urgent care or the ER. We have some close urgent cares. For knowing the ones that take your insurance, you'd have to call your insurance company just to know which ones are accepted where. I wouldn't know off the top of my head which ones accept United Healthcare, Medicare Advantage. I just don't know off the top of my head, and they change often. Concerns about other residents. I have a concern about another resident. What do I do? You can tell me. Let me know. I have residents that come in all the time and say, Mrs. Smith didn't come to Bridge today. Okay, thank you. Mrs. Smith hasn't taken a shower in 2 weeks. I'll go and assess that. You know, if Mrs. Smith just missed 1 day of bridge, I'm not concerned about missing 1 day of bridge. I'm concerned about Mrs. Smith not taking a shower for 2 weeks because maybe there's an issue going on there. Now, if Mrs. Smith doesn't come to bridge multiple times or forgets how to play bridge or is causing a scene in the dining rooms, then that's where I get more concerned. So yes, you can come to me and report it. You can email me and report it. I never go to that resident and say, Mr. Jones told me that you didn't take a shower for 2 weeks. I never say that to the other resident, okay? I usually put the blame on myself. You know, I saw you last week and blah, blah, blah. Another resident keeps asking me to help them. I don't want to, or I can't. What do? You don't have to help any other resident. You didn't move in here to become someone's caretaker. So let me know if a resident keeps asking you to help them, because there are some things that we can do for that resident. We can talk with them, we can talk with their family to either get in caregivers, or then we need to start having the conversation about higher levels of care. I see a resident who's no longer appropriate, I think, for living in independent living. Why can't they just move? Why does it take so long for a resident to move? It's a process. I can't snap my fingers and make a resident move. Sometimes it takes a while for a family to understand what's going on, for the resident to understand what's going on, to get them to want to move. Or maybe we want to try therapy. Maybe we want to try caregivers. Maybe we want to do labs in the clinic. There are steps to these processes. So it may seem like a long time, and it may be a long time, but we've got to get everybody on board. What if an associate has concerns about us? Then they tell me. They tell Rachel, and then we look into it. This is a new thing that I'm going to be, it's very small for you to see, but a new concern report form that I'm going to be rolling out to the staff. So it's just another way for them to report, especially for people who don't have email, or staff that don't have email, different things that they can look for in the residents. And then they can just put their name and department, describe their concern, and then give it to me or Rachel so we can follow up, just to have a paper trail. Moving to a higher level of care. Remember, this is a process that may seem by an outsider that it takes a long time for movement. Try to get the family on board, try caregivers, adjust caregiver time. So maybe having a caregiver from 8 to 9 a.m. doesn't work. Maybe it needs to be from 9 to 10. Maybe it needs to be from 11 to 12. We will try and try and try. We're giving them a chance to be as independent as possible. Some families are in denial, so it takes time and documentation about what's happening. I'm scheduled for an outpatient procedure, colonoscopy, dental extraction, cataract surgery. Do I inform you? Please. What services are provided? Transportation. Transportation, yes, if it's within our hours. Just talk with reception to get the hours of the driver. I don't know the hours off the top of my head. I think it's also in the monthly newsletter, the hours of the transportation. Mm-hmm. We also have the wellness check. So if you come back from a colonoscopy and you're a little loopy, the wellness checks, they can come and check on you and maybe get you dinner for the evening, let you sleep it off, and then we can check on you a little bit later. Do I get introduced to the caretakers that work under your supervision? Yes. I live alone, no children in Austin. Is it necessary for me to hire a halcyon or other vetted attendant? Not necessarily, it just depends on your situation. You could go with another company. I have anesthesia or other twilight medication. Do you stay with me? No. I have a family. I have a home that I'm not here 24/7. But we have the wellness aides that are here 24/7. In some situations, we've gone in for 24 hours, every 2 hours to check on a person. We offer that. Everybody's situation is different, so come see me, talk about your situation, and we can adjust. I don't know unless you tell me. We talked about this. If you get a prescription for therapy, bring it to me. If you don't want to use Select Rehab, you can use another company and they can come in and provide therapy in your apartment. You're ill over the weekend, you call your physician and they recommend a prescription. I use a pharmacy that doesn't offer weekend delivery and you don't drive. Is there an employee that can pick up my prescription? No. What do? Probably get a pharmacy that delivers, or have a pharmacy backup that delivers for emergencies like this. There are options that are close here. One of them is Terrytown to have as a backup. If you have a prescription in an emergency like this, you can also have them bring you a Coke and a greeting card. On the resident portal, there are a couple of resource guides. So if you go to the portal and you actually log in and you scroll all the way to the bottom, there's a little tab that says resource guides. And these are some booklets that I've been working on for a while. So there's health and wellness amenities, so that's everything that's here at Westminster. There's the resident health services. Let's see if there's you can't see it. There's the resident health services resource guide, so that talks about everything my position does. There's a pain management guide, and then physical therapy resources and massage. So if you go to the portal, there's those packets if you want to take a look at those. This is always fun. This in-care list. So if you're logged into the portal, on the left-hand side where the blue is, it says in-care list. I always get a lot of questions about this. So yes, I'm the one who manages that. I can only update it if you have signed the form that has said, yes, you can post my information for other residents to know where I am. If you have not turned it in or have signed the refusal, I cannot post your name here. So you may know that your friend went to the healthcare center, but if they have not signed that paper, I cannot post their name here. So if 5 people have gone to the healthcare center, and you know they've gone to the healthcare center, but this has not been updated with their name, it's because I can't update it with their name. And that may irk you, but there's nothing I can do about it. I can't put them on here because they either have not turned in the form or they have signed the refusal. And I'm so sorry that I cannot post your friend on there. But if you want to convince them to sign the form, then you can try. Otherwise, I can't. And it says, last updated 5/14. I look at this. I have it on my calendar to look at it every week to make sure it's updated. And I could probably put last looked at this time, but that's just more work. I take a look at it though. Thank you. Come see me. Everybody's resident. Every resident situation is different. I have 457 independent living residents. So that means I have 457 different situations, different diagnosis, different everything. If you have an issue, if you have a concern, please come see me, because even everything that I said here today may not apply to you, or you may need more than what I said today. You may need something more in depth than what I said today. So reach out to me, and we will come up with a solution for you, okay? If I haven't met with you since you moved in, I did bring a sheet today where you can write your name and apartment number. I usually try to do an orientation when you first move in, but it's just been a crazy couple of months. If I haven't done a new resident orientation with you, let's write your name down and I will schedule that with you. Thank you. Yes.
Does anyone have questions?
Oh,
Okay.
I have a question about the little pendant that I wear.
okay.
One of the residents told me I should wear it in the shower.
You can. You
I don't-
can't
I don't-
submerge it.
I don't wear it in the shower.
Okay.
Second
Do you
question-
have a pull cord close to
Yes.
your shower? Okay. Okay.
Second question is, what time can you check in the morning? Because I get up at 5.
By 5:30, I tell
Okay.
people 5:30.
Okay, and what's the latest?
I tell people, because they usually run the report at 10,
Okay,
so I tell people by 9:45.
okay, good.
Just to give it time to get through the system.
Okay.
So then they run the report at 10 and print the paper, and then that's when they start calling people.
Okay, and one more question.
Yeah.
The Bowles lights, I cannot get the top off of mine.
Okay,
So everything in there is the same.
okay. So what we do is when we send you your annual medical history update, you send us back everything, we update it. When we come to your apartment, we exchange that. So if you don't change anything ever for the whole year, we change it once a year. Yeah, but if you want to update a medication between the year, just let us know and we can come update it. We can open it for you. Yeah, I know they're difficult if, you have arthritis or something, they can be difficult to open. Yes, ma'am?
Thanks, Robin, for the presentation.
You're
I
welcome.
have a quick question on
Sure.
COVID.
Okay.
I understand we have an outbreak of COVID here at Westminster.
Okay,
And there's various numbers.
Okay.
I heard some person said 1, someone else said 19.
okay.
Could you help clarify that for us?
Sure.
Thank you.
So the COVID that's going on right now is in the healthcare center, not in independent living. So in the healthcare center, I believe it's 19 residents and 5 associates. Yeah. It's all mild or no symptoms. Yeah.
Robin, what about RSV? If there is RSV going around, do you know that?
I have not heard that RSV is going around.
I know, I didn't mean, is there? I meant, if there were.
If there were and somebody was diagnosed with it, then I would know about it.
Okay.
Yeah. As long as a resident, say they went out to their medical doctor and they got diagnosed with it, they would have to tell me, because I don't read minds. And so they would have to actually tell somebody. Yeah.
Yes, you talked about the wellness center, and then you talked about the wellness clinic. I used to think they were the same thing.
We call,
Repeat that question.
I said the wellness center and the wellness clinic, he thought they were the same thing. We call a lot of things a lot of different names. So, yes. Short answer, yes. So yes, wellness center, wellness clinic. Just like the healthcare center, we also call long-term care, rehab, skilled nursing, the arbor. It goes by all those names. So it can be confusing.
But would people that only check then into a long-term care thing, they wouldn't check into the wellness thing?
You don't check into the wellness clinic. The clinic is the nurse practitioner clinic. That's open Monday through Friday. Yeah. Some people call it the wellness center just because the wellness area is my office, the gym, the pool, the fitness studio, the beauty salon, the clinic, and therapy gym. Like, that's the wellness center. And the wellness clinic is in the wellness center. That's what that is.
Robin, I may have asked you this before, but I can't remember your answer. I encountered someone being wheeled to another part of the building who was very distraught, crying out, and so on. And at the time, the Westminster nurse who was in the elevator, I said, do you use sedatives? She said, no, it's a policy, we can't give shots. And I said, what do you do, restraint systems then? So I was just curious, is that a policy that you can't calm somebody down with a sedative?
So it depends on the individual person. So that's probably the healthcare center. So the healthcare center is healthcare in general is a highly regulated, one of the highest regulated entities ever. There are policies and procedures regarding sedation because it is considered a medical restraint. If you give someone a medication to stop what you consider behaviors, it's considered a medical restraint. Any type of tying someone down is considered a restraint. So yes, there are policies against using restraints. If that resident has a medication to help calm them, then a nurse could give that to them. But that has to be reviewed by their doctor. Their consent has to be signed. It can only be given for a certain amount of days. It has to be reviewed. It has to be care planned. It's a highly regulated thing. We have a policy where we don't give medications just to make people stop complaining, having outbursts or responses to things that are happening around them. So those behaviors that you're saying is an unmet need. So are they hungry? Are they in pain? Do they need to go to the bathroom? Is something else going on? So there's an unmet need going on. So if they're in pain, why would we give them a medication to sedate them? If they're sad, if they are needing to go to the bathroom, why would we give them a medication to sedate them? We've got to figure out the root cause of that unmet need and not give a medication just to sedate them. So that's why it's so regulated, those types of medications. So yeah, there are rules and regulations and policies on that type of medication. Yeah.
Any more questions?
Anything else?
Will you fill out your evaluation, just leave them on your chair, bring them